the environment affects the survival and well-being of its inhabitants. In many situations, the environment can be controlled to provide a maximum benefit for a specific population.
แบบหนึ่งอันนี้เป็นเขาสอนพยาบาลที่อเมริกาแต่ว่าที่เขาทำเป็นไอ้วิดีโอเนี่ยมันค่อนข้างจะสื่อให้เข้าใจได้ง่ายนะวิดีโอนี้เก่ามากเลยยังหาแบบของใหม่ๆที่เขาทำไม่ได้แต่อันนี้เป็นอันที่เราคิดว่าน่าจะดีที่สุดที่เราเห็นมาส่วนอีกอันหนึ่งเดี๋ยวจะเป็นเรื่องวิธีการเตรียมตัวสัตว์ซึ่งคุณน่าจะต้องได้ขึ้นไปทำหลังกันนะครับส่วนที่เหลือเดี๋ยวเรื่องแต่งถุงมือแต่งตัวเดี๋ยวเราคุยกันตอนบ่ายวันนี้ก็จะมีวิดีโออยู่2 อันอันแรกเราจะคุยกัน
In the hospital, the operating room environment is one that must be controlled. It's designed to ensure maximum benefits and safety for every surgical patient. The concepts and principles of aseptic technique are used in creating and maintaining that environment. An effective method of controlling infection in the operating room is through the use of aseptic technique. Aseptic techniques are the methods used to maintain asepsis. Asepsis is the absence of disease-causing microorganisms. Surgical aseptic technique is creating and maintaining a controlled environment free of bacteria, viruses, and fungi. This is also called sterile technique. Sterile means being maximally free of all microorganisms. Sterile field is the area and people immediately around a patient that have been prepared for a sterile procedure. Microorganisms can come from 2 main sources, endogenous sources and exogenous sources. Endogenous microorganisms are normally found within the body. These may cause infections when the patient's own body defenses are low. Factors that increase patient susceptibility to endogenous infections include malnutrition, age, obesity, chronic disease, and impaired defense mechanisms. The nurse can help defend the patient against microorganism invasion by using aseptic techniques in preparing the skin, inserting a catheter or monitoring device, or starting IVs. Patients can also be infected with exogenous microorganisms that are outside his or her body. Safeguarding the patient from hospital-acquired exogenous microorganism infection can be accomplished in many ways. Controlling traffic in the surgical suite is one way. Traffic patterns for specific areas are defined in AORN's standards and recommended practices. Unrestricted areas, where street clothes can be worn, include control points where the suite interfaces with the rest of the facility. Semi-restricted areas are the peripheral support areas within the OR suite. These include, but are not limited to, storage, work areas, and corridors. Here, scrub attire and caps are worn. The restricted area requires full operating room attire, including masks. These areas include the clean core, sub-sterile areas, and operating rooms. Another environmental factor is the control of air currents. Effective air ventilation and filtration, unidirectional air currents, and laminar flow rooms decrease airborne contamination. While air turbulence created by opening doors, fanning of linen, excessive numbers of people in the OR, incorrectly worn face masks, and excessive talking may all increase microbial numbers. Environmental sanitation is also a factor in preventing transmission of exogenous microorganisms. Germicidal cleaning solutions used in environmental sanitation destroy microorganisms. Germicidal chemicals that kill most viruses, bacilli, and fungi are called disinfectants. They are used on inanimate objects. There are three main methods used in cleaning the OR. Concurrent cleaning is the ongoing cleaning immediately after the discharge of infectious material. End-of-case cleaning is performed between surgical cases. Terminal cleaning can be done following the final procedure of the day. All of these factors are important in controlling the operating room environment. However, people are the major source of contamination. The primary factor in
ตัวแดงๆเนี่ยตัวแดงๆนี่ contaminate ตัว contaminate ตรงไหนที่มันอันตรายหรือ contaminate ก็จะเป็นตัวแดงๆแบบนี้ขึ้นมาเห็นไหมต่อจากนี้ไป
Controlling exogenous microorganisms is adequate washing of hands before any patient intervention using antimicrobial solutions. The surgical team is responsible for isolating microorganisms by their practice of aseptic technique. The foundation upon which aseptic technique is built lies in the surgical conscience of every person in the OR. Surgical conscience is knowing and adhering to the principles of asepsis and sterile technique at all times. Each person's behavior and actions are guided by their internal beliefs and attitudes. Therefore, when one has a surgical conscience, performance of aseptic technique is consistent, whether the person is alone or observed. The person with a good surgical conscience must also have self-discipline, good anticipatory skills, and the maturity to perform correctly in every situation.
เห็นมองทันปะเขาเปิดของที่สเตอร์ไลน์เนี่ยแล้วมันไปโดนโต๊ะข้างๆที่ไม่สเตอร์ไลน์ไม่มีใครเห็นมีเขาอยู่คนเดียวแต่เขาก็รู้ว่าเขาทำผิดพลาดคือเบรกของง่ายๆว่าเนี่ยมันเป็นเซลล์ที่ไม่คือมันเป็นจิตสำนึกส่วนบุคคลทำเพื่อส่วนรวมไม่ได้ทำเพื่อตัวเองงั้นเวลาจะเป็นหมอก็เช่นเดียวกันนี่เป็นแบบเบสิกพื้นฐานเลยที่คุณต้องทำก็คือไม่มีคนเห็นหรอกที่คุณทำผิดไปบนโอวานะแต่ท้ายที่สุดคุณต้องยอมยกมือมายอมรับผิดแล้วก็โดนพี่เนเชียนว่าโดนอาจารย์ด่าแต่ก็ต้องยอมทำเพราะเพื่อสัตว์ส่วนงั้นกลายเป็นจิตสำนึกส่วนบุคคลนี่แหละสำคัญที่สุดเลยนะครับเพราะฉะนั้นเดี๋ยวดูต่อมันมีของเราที่เราสอนคุณมี12อันนี้ก็มีแปะแล้วตัดลงมาแต่บางอย่างก็จะอิงจากบทเรียนที่คุณเรียนมาแล้วอันนี้เอาไม่ดูทีหลังทำไมไม่ดูตั้งแต่ตอนแรกจะได้อินไงเพราะว่าถ้าดูตอนแรกตอนที่คุณเรียนอ่ะคุณยังไม่ท่องหนังสือต่อคุณจำไม่ได้เราก็เริ่มเปิดแล้วหลังทุกคนก็ถามว่าอาจารย์ไม่ทำให้เปิดก่อนนะทีแรกเปิดไปตอนนั้นคุณจำไม่ได้เปิดตอนแรกคุณแบบเป็นไงโอ้โหจำได้เลย12 ข้อทำไมจำอีกแค่10 ข้อก็อีก2 ข้อเปลี่ยนไปได้ก็ได้เต็มอยู่ดี
Knowledge of concepts and principles of aseptic technique is essential for controlling the operating room environment. There are 8 principles of aseptic or sterile technique. Principle number 1. All items used within a sterile field must be sterile. There are many ways to kill microorganisms to provide sterile instruments or supplies. Sterilizing agents include steam, ethylene oxide gas, liquid chemicals, dry heat, and radiation. Sterile items are kept in closed storage located in appropriate areas. These instruments and supplies may be packaged in a variety of materials, which can be reusable textiles, non-woven fabric, plastic, or hard containers. Packaging material must allow sterilizing agents to penetrate its contents while providing a barrier to environmental microorganisms. The length of effectiveness of package sterility, also called shelf life, is event, not time, related. Storage area conditions, methods of handling, and type of packaging are some variables which determine the length of effectiveness. Each sterile package must be inspected for integrity before being opened to ensure that its contents have not been compromised by holes, punctures, rips, or moisture. To comply with external regulations, an expiration date is marked on all internally processed materials. Some commercially packaged materials may be marked with either a date of manufacture or sterilization expiration. Sterility process monitors indicate a package has been exposed to the sterilization process. Monitors can be inside or outside of the package and can be discs, tablets, solutions in small containers, or chemical tape. Always check the following before opening a sterile package: the integrity of the package, the expiration date, and the sterility process monitors. Principle number 2. A sterile barrier that has been permeated must be considered contaminated. Sterility can be compromised if permeable materials are used. When moisture soaks through a package, it's called strike-through. Any article that has become wet is considered contaminated. Even if strike-through cannot be directly observed. Many of today's materials are fluid-resistant and antimicrobial, but may be punctured or torn. If a sterile barrier is mechanically disrupted, for example, a needle puncturing a glove, a surgical conscience will demand the situation is acknowledged and corrected. Hard container systems should have intact filters. Principle number 3. The edges of a sterile container are considered unsterile once the package is opened. These boundaries are hypothetical and are safety margins. The boundaries should be maintained in an aseptic environment to prevent accidental contamination of a sterile field. In opening large packs, the cover becomes the barrier to create the sterile field. With some commercial packs, place your hand under the fold of the material. Open the back, and then the front flap. Each side flap should then be opened. Care should be taken to walk around the pack and not reach over the sterile field. When opening small packages, open the far side first and the near side last. Secure the wrapper tails so they will not spring back and contaminate the sterile item. Extend the contents toward the sterile person so he or she can lift it away from the package cleanly without touching the wrapper sides. In opening peel packs, separate the edges by rolling them back over your hands. The sterile contents can then be offered to the scrub person in a way that minimizes the possibility